I'll often have patients come into my office wanting to know if they're in menopause based upon symptoms that they're having. It's not usually much of a mystery, oftentimes they sure are. I'm Dr. Monica, board certified OBGYN, and in this video, I want to go through some of the symptoms of menopause, times that you can feel pretty reassured that these are common normal symptoms, and times that we might be a little bit concerned that something's going on or you need to be evaluated. Either way, all of these topics are a great conversation to go over with your doctor to see if you're someone who might benefit from some treatment. All right, so what symptoms do we commonly see in menopause? I know a lot of this stuff is all out there on the internet, but I'm going to go through this all with you in a nice, organized fashion to kind of let you know what things most people will see when they get into perimenopause. Now, the first thing I'll tell you is that everybody is very different and you can't paint everybody with the same brush. I will have some ladies who are just completely blessed who have a period, they never see it again, and they never have any symptoms. But usually that's not the case. Around 80% of women who go through perimenopause and menopause will have some type of symptoms associated with it. And all of these are due to declining levels of estrogen. So one of the first and more common things that we see is a change in the regularity of your menstrual cycle. So as the system shuts down, this is kind of like a reverse of puberty. So everything while you're in your reproductive years was working in this nice cyclical fashion, everything doing what it's supposed to do when it does it. But when we get towards perimenopause, it doesn't usually just turn off. Usually it will kind of go piece by piece. And as portions of the cycle begin to shut down, it becomes irregular. So instead of ovulating, instead of having a nice regular cycle that falls around the same amount of days each month, you start to see some irregularity. Oftentimes this will be something like, oh, I had 2 months between my periods, and then I had a period every month, and I went 6 months, and then that one was a little heavy. Those are things that are really common to hear in the perimenopausal stage. Now, when are bleeding problems concerning? Of course, if it bothers you, always let your doctor know because there are treatment options regardless of if it's otherwise concerning. Some people come in and they just want to know that what they're experiencing is expected and normal for perimenopause. Some people are like, I'm not down with this. Let's get this fixed up. Either way is fine. When it would be concerning would be if you're having frequent and heavy periods. It's pretty common if you've gone a while without having a period to have a little bit of a heavier bleed when you do get a period. But if you're consistently having really heavy bleeding, if it's heavy enough where you're passing out or you're not feeling well, or if it's really frequent and you're having bleeding all the time or lots of spotting in between the periods, things like that you should bring up with your doctor. Associated with this is a decline in fertility. So the average age of menopause is 51, but it's normal to start having perimenopausal symptoms as early as 40. So as we start to see this process shut down, I mentioned earlier, ovulation sometimes doesn't happen. So someone who might be 41 or 40, if they're starting to have perimenopausal symptoms and they're hoping for a pregnancy, they might see some issues with conception as fertility declines. Now, we certainly expect fertility to decline as we get further into perimenopause and closer to menopause. Until you've actually stopped having your periods, you technically do need to still prevent pregnancy just in case if it's not something that you're looking for. Next symptom, we've all heard about it, hot flashes and night sweats. This is a very common symptom of menopause. About 80% of women will experience these to varying degrees. Some find them debilitating, some find them mildly uncomfortable. It all just depends on how your body is and how your body responds. And the reason that these things happen is kind of interesting. Your body has a natural thermostat. As you know, if your core temperature drops to a certain amount, you'll start to shiver. Your body will want to bring your temperature up. Similarly, when you exceed a certain temperature, you start to sweat because you want to cool yourself down. Your body likes to be in just a very kind of specific range. Now, when we go through menopause and perimenopause, that range gets very, very narrow. So just a slight increase in temperature can trigger those cooling techniques that our body naturally does, even though you weren't really that hot to start with. A very key symptom of menopause is what's called the genitourinary syndrome of menopause. And what this means is that the tissue and the structures of the lower genital tract and the lower urinary tract, mainly meaning like the urethra, they change in their quality. So they become thinner, less stretchy, less pliable, and they don't function as well as they used to. So what does this cause for symptoms? It can cause recurrent UTIs. It can cause discomfort with intimacy. It can cause easy irritation, dryness, burning, easy tearing with intercourse, those type of things all have to do with the way the quality of that tissue changes due to declining estrogen levels. Now, tied in with this some is a decreased libido, both from a desire standpoint and sometimes from some aversion to intimacy because of the discomforts that we talked about before. So these symptoms are all what we would consider like the mainstay symptoms. These are the ones that are listed in an ACOG practice bulletin as the main symptoms of menopause. But as we know, there are a lot of other symptoms that are rolling into this as well that definitely need to be acknowledged. So these are things like sleep disturbance, memory problems, brain fog, sore joints, as well as weight gain and other just changes in your body. Now, a lot of these have to do with estrogen. Certainly, sleep disturbances can come from having hot flashes and night sweats because you're not able to sleep well. But also just the natural sleep process becomes affected as we age and as we go through perimenopause. Mood disturbances, also common. Some probably having to do with sleep deprivation. I'm certainly not in a great mood if I don't sleep well overnight. So having less sleep, more issues with sleep getting you that rest that you need, as well as, again, the natural changes that lead to some moodiness as well. Now, sometimes this can be as extreme as leading to anxiety and depression during this time. Brain fog is a definite symptom I hear about a lot, and that true cognitive function, like really understanding an in-depth process, stays the same, but just kind of light mental processes like remembering your grocery list or did I call my son back? Those type of things sometimes kind of go out the window during this process as well. And as time goes on and more research studies come out, more and more symptoms are coming up as being attributable to menopause. Now, what I'll say about all these symptoms is yes, they're normal and yes, they're expected, but do you have to suffer through them? No. If these things are bothering you, go to your doctor and talk about them and see, are you a candidate for some hormone therapy? There are plenty of options out there, and there is a whole nuance of looking at and evaluating the risks and benefits and any person's individual risk factors to see if maybe a treatment would be appropriate for you and if you'd be a good candidate. You don't have to just suffer through it just because it's normal. And some people may choose to. I have all types of different conversations, and that's why the nuance and the individual evaluation is so important. Because I will have people who come in and tell me all these symptoms, and I say, hey, you're in perimenopause. This is what's going on. Would you like to talk about treatments? And they're like, oh no, I just wanted to know that it's normal. Like I'd rather not start another medication, or those risks sound like it's not really worth it for me. And I'll have other people with relatively mild symptoms, but I say, oh, those sound like perimenopause, and they say, how can we get rid of it? Let's get rid of these. And I have people who are on hormone therapy who will talk about considering coming off as they age, and they say, I'm taking it to the grave. There's just such a wide array, and the only way to know where you stand is to have a conversation with your doctor and figure out the risks and benefits and what might work for you. If you found this information helpful, please drop a like and consider subscribing to my channel where I talk about all different topics in OBGYN. I'll see you next time.